Hi everyone, I'm Huang. On behalf of my colleagues, I'll present our work on users' expectations, experiences, and concerns with COVID Alert, an exposure notification app. To fight against COVID-19, 120 contact tracing apps have been launched worldwide in 71 countries and regions. Previous studies about contact tracing apps focus on identifying the privacy and security risks with the apps and learning the public's intentions of adopting the app. However, real users' experiences with the app have received little attention. Their experiences may reveal the underlying issues with the current design of the app. We therefore conducted our investigation through semi-structured interviews with users of the COVID Alert app. COVID Alert app is Canada's national contact tracing app. It can notify users who had been in close contact with another user who tested positive for COVID-19. The app uses Bluetooth signals to identify nearby phones. If an app user tests positive for the virus, their local health authorities will give them a one-time key. This user then has the option to use the key to enable the app to notify the users who had been in close contact with them. Users who receive a notification will also be provided with guidelines to take. Our interviews focused on three aspects. First, participants were asked to describe the COVID-19 exposure scenarios of which they wanted to be notified and the reasons they wanted those notifications. Then we used a combination of a drawing exercise and a verbal explanation to obtain participants' understanding of the app. Last, we explored participants' concerns about the app and their coping strategies. 20 participants were interviewed. They were diverse in age, occupation, and educational level. Now I will report some results. Since one of the main functions of contact tracing apps is to alert users when they have been in close contact with COVID-positive people, we sought to understand participants' expectations for learning about their exposure to COVID-19. We identified that participants wanted to learn about the time and place of the exposure, to understand the severity of the patient's symptoms, to obtain detailed behavioral guidelines, and to know the identity of the COVID-positive people. For instance, participants wanted to be informed about the time and location of the exposure so that they could conduct their own contact tracing and estimate their likelihood of being infected. Now I will report on participants' mental models. We classified mental models based on the differences in participants' understanding of the app's 8 aspects. In general, we identified 4 types of mental models. In this presentation, I will explain unsound mental models in detail. Participants with unsound mental models had several important misconceptions. First, participants believed that the app decides that they were exposed to a COVID-positive user if they were at the same location and at the same time as that user. Another misunderstanding is that some participants believe that the app could inform them in real time when a COVID-positive user is nearby. Last, some participants were aware that the app used Bluetooth signal to identify nearby phones. They nevertheless misunderstood that the app collects their location data. Now I will introduce the concerns we found. Participants expressed various concerns about the app. We found that their concerns were associated with their understanding of the app. This figure illustrates how participants' correct understanding or misunderstanding of each aspect of the app is associated with their specific concerns. I'll explain several identified concerns. First, privacy concerns. Only the participants with unsound mental models had privacy concerns. We classified these concerns as unjustifiable concerns as they were based on participants' incorrect belief that their location data is being collected by the app. Some participants were concerned about the government using their location data for surveillance purpose. Some other participants saw that their location data were used by the app operator for their own benefits. To address the privacy concerns, participants believed that they had to make a privacy utility trade-off. For instance, although participant 5 had concerns about her location data being collected by the app, she continued using the app and stated, otherwise how would the app know we had been in contact with some patients? Participants also believed COVID Alert did not provide exposed users with enough information about the exposure. As we explained previously about the participants' expectations, they wanted to be able to conduct their own contact tracing and estimate their likelihood of being infected. Therefore, we learned about the guidelines provided by the app. Some of them expressed dissatisfaction with it and questioned the app's usefulness. For instance, participant 8 stated, it does not tell you the day, it does not tell you the place, and it does not tell you the time, and it does not tell you the person. Many participants were concerned that exposed users might ignore the app's instructions and possibly spread the virus further. Participants were aware of how exposed users would receive a notification, which would also include recommendations for the next steps. They also acknowledged that there was no way to ensure that the exposed users followed the recommended actions. Hence, referring to the news that people do not always follow restriction rules, participants questioned the effectiveness of the app. For instance, participant 11 explained, I'm aware of the news that not everyone is decent people. I think there are people who just ignore the notification. We made several recommendations based on the results. First, the value of COVID alert in limiting the spread of the virus was perceived to be treated for its protection of users' privacy. We therefore suggest app developers consider providing exposed users with the approximate time and place of the exposure to improve the utility of the app. This additional information would enable users to conduct their own contact tracing, increasing the app's utility to the community and reducing the cost of contact tracing by the health authorities. We believe a better balance between the privacy and utility could be reached by giving users more control over their own data. Second, technology companies were not considered trustworthy providers of the contact tracing apps. Participants with Unsound models distrusted the technology companies as the app providers because of their data practice. We therefore suggest app developers build and maintain the trust of the public. For instance, the company could help the public to better understand their data collection, retention, and the sharing practice. Last, provided guidelines were perceived as unhelpful. Specifically, some participants believed that the guidelines provided by the app to the exposed users were too general, provided no specific details, and were unnecessary in some cases. We therefore suggest providing more details in the guidelines. As an example, it could be further explained why taking a test even before the symptoms arise is a necessary first step after exposure. In summary, we conducted semi-structured interviews with 20 users of COVID alert. We identified several types of users' mental models of COVID alert. Participants' concerns were found to be correlated with their understanding of the app. Based on our findings, we made several suggestions to improve users' experiences. Here is our research team. Thank you.